tracking bird flu. But despite this, the CDC is not changing its risk assessment for the general public. Joining us now to talk more about it, Onondaga County Health Commissioner, Dr. Katie Anderson. Katie, always good to see you. Thanks for joining us again.
Thanks, Jeff.
So we talked about this with you just a couple of weeks ago. Now that a third person has bird flu, it's obviously a very small number, but it's 2 in a week. They're both in Michigan. It may feel like it's spreading. Why is that risk level for people still very low, right?
Yeah, so as you mentioned, this is our third human case in the last 2 months, second in Michigan, and really the fourth in the U.S. since 2022. But it's important to say, as you mentioned, that this does not change our risk assessment for the general population. And the reason for that is when we think about avian flu or the potential for these highly pathogenic, very severe influenza outbreaks, think 1918, we worry about rapid spread from person to person and the potential to cause very severe disease. In this case, all 3 of these cases related to dairy cattle were resulting from human exposure to cows. There's no evidence yet that it's gone person to person, and these cases have been relatively mild with none of these symptoms of pneumonia or organ failure in humans. So at this point, the risk assessment doesn't change, and this third case doesn't change that much for us.
3 human cases, though, all getting bird flu, as you mentioned, from infected cattle. Hasn't been reported here yet, but what is the best way? Would you say it's a good idea to take kind of preventative measures here now, or is that more in areas where they've definitely detected it in cattle?
Yeah, so for the general population, there's not much that we need to do in terms of changing our behavior, with the notable exception that this is not the time to be drinking raw milk or eating raw cheese. And most of the products that we buy in the store are pasteurized, which means that they've been heated to high heat. That would kill off the virus. So no need to do anything for most of us besides stay away from raw dairy products. But an exception to that is people who work with dairy cattle right now. And we know in upstate New York that we're the 5th largest producer of dairy products in the country. So we have a lot of people who are farmers or otherwise working with cattle. At this time, CDC is recommending that those folks who work closely with cattle, work with animal feces, work with the milk itself, are wearing personal protective equipment. So going back to gloves, these N95 masks, just during this time period where it seems as though there's a fair number of cases nationally of dairy cattle, of H5N1.
Yeah, chances there is bird flu somewhere here in New York, but it just hasn't been reported?
I think nationwide, this has been largely underreported and underdetected, and there's a variety of reasons for that. Michigan stands out in the fact that it has gone above and beyond in terms of its surveillance, in terms of active case detection. So I don't think what we're looking at right now is an epidemic of H5N1 that's focused on dairy cattle in Michigan. What we're seeing is, because Michigan's really looking for it, signals of an epidemic that's probably nationwide. So we haven't found it yet in New York State. We've had no detected cases in cattle, no detected cases in humans. But one thing to point out is that in New York, just like across the country, these wastewater surveillance systems that were set up for COVID have now been adapted to look for influenza A, which is the type of influenza that H5N1 falls into. So we'll be able to be watching for increased signals of increased influenza A at a time when we should not be seeing typically increasing levels of influenza, so we can watch in the region. And the other thing I'll mention is that the federal government has been responsive to what perhaps in the last few months might have seemed like disincentives for dairy farms to be proactively looking for cases. There's now more incentives, there's now more collaboration. And so I think we'll probably start to see more farms picking up cases in their cattle, but that's not necessarily a sign that the epidemic is worsening. Okay,
maybe time for one more. And I know last time we talked, if I remember correctly, you said this is kind of something that's been on the radar for 20 years, avian flu. Now we've seen it go from birds to cows to humans. What are scientists, what are health officials like you kind of watching as we look out forward here?
It's thought, and it still seems to be the case, that the risk to humans, to New York, from this specific strain of H5N1 that they're finding in dairy cattle is thought to be really low. What we worry about, and this is the uncertainty that's been with flu for decades or hundreds of years, is when is it going to shift and become that one that we're really concerned about? So going into the fall, you're going to hear us talking about this more, about how people need to be getting their influenza vaccines, because what we really don't want to see is a human influenza virus and a dairy cow H5N1 may mix together. and then potentially increase the risk of something to be worried about. But right now, the risk to us is low, and we'll just be taking steps to keep watching it and vaccinating against human flu.
Dr. Katie Anderson, you know we always appreciate you getting us informed on these issues, so we appreciate your time tonight. We'll see you again soon.